right, we are broadcasting live on YouTube.
All righty. Thank you very much.
And we have, looks like we have 15 participants,
All righty.
15 attendees on here with more coming on.
All righty.
So I will hand it off to you, Chris.
All righty. Thank you very much, Eileen. Like to welcome everybody. Eileen, if you could bring up the slides, we'll get going. This is our July quarterly town hall. We've started these about 4 years ago. Initially traveling about the county, we would attempt to do one generally in the Elizabeth, Kiowa area, and then one in the outlying areas back to back each quarter, face to face, to get the opportunity to provide updates on ongoing county issues and just discuss items of interest to our citizens. So just a chance to communicate a little more freely. Eileen, it looks like we're up on slide 6. If you could bring up 2, that would be great.
Got it. We're giving people a preview.
Yeah.
There we go.
All right. Yeah. Just as I said, we generally, our business meetings of the county are held during business hours. As folks come to BOCC meetings, perhaps for an item that's of specific interest to them that day, they'll hear bits and pieces of lots of other things that are kind of going on and are in midstream. So it's generally not the most informative. Once we kind of hit COVID and started live streaming a lot more and using these Zoom meetings, I think it is a lot easier now for citizens they can go back and look at previous meetings if there's something that caught their interest while attending one. They can look at what was discussed and what led up to it. But these town halls are still very important to us in order to make sure we're having some opportunity just to have some little freer discussion with folks. So I don't know, the slides seem to be just randomly appearing, but
oh geez. Because it looks like there's a timer on them. So let me see if I can.
Oh, that's yeah.
Yep. Well,
that's
I'll
true.
see if I can adjust them. Yeah.
Okay.
So keep going.
Yeah, sorry about that. Alrighty. Yeah. So the agenda that's showing now is what we'll follow. Just a brief presentation from myself, Commissioner Pettit, and Commissioner Thayer. The 3 topics we really wanted to touch on tonight, from our point of view, were the actual COVID caseload, what's going on currently in the county, and what our response has been. I'll discuss that for a bit. Grant wanted to talk about the financial aspects of COVID, both on the county budget and just general economic impacts that we're looking at. Excuse me. And then Rick was going to talk briefly about the update of our county transportation plan that just kicked off, and then we'll open this up for questions and answers. We'll run until about 8. If said, we've got quite a few participants, so hopefully we'll be able to give a chance to get everybody's questions answered. But Eileen, if you could move on to number 4 now, that would.
You see it?
It's coming up. It's kind of overlaid with 3. There we go.
Yeah,
it's fully up now. I think there were some transitions and timing that I didn't get rid of.
Got it.
So alrighty. So there's an awful lot on this slide. It's kind of a work in progress, but it kind of shows a little bit of history and where we're at right now in regard to COVID. If you're looking at the upper left, there's a block called case tracking. And this slide's, most of the data is drawn from a little earlier in the week. We've had a couple of cases come up since, but as of the date the slide was made, we had 67 positive tests, citizens testing positive for COVID in the county, and 4 that were currently active. So that 67 number goes back to the first test that a citizen took that returned a positive on the 12th of March of this year. So we're, well into this 4 months in at this point. With 4 active cases now, 60 of those citizens have recovered. We're tracking 3 deaths. Looks like we just bounced back off again.
Yep, I know. I'm just trying to take the transition off.
Okay, appreciate
So
that.
here we go. Can't guarantee.
All righty. All right.
Should be back up. Yeah.
All righty. Yeah, no, there are 3 deaths. We know there have been 3 deaths that are related to COVID. We're not 100% sure, haven't gotten all the information we need to determine if 2 of those were deaths of COVID or with COVID. Regardless, they're the deaths of 3 citizens, and that should give everybody pause. But the first death was very early on in March. It was a elderly gentleman that had several underlying conditions, but certainly had COVID and was tested positive. The other 2, we don't have a record of test at all, just a notation within the state reporting system. So we're trying to get more background on those. But where we sit in incident rates, the next one down over the last 14 days, and generally the 14-day period is what's considered to be the time period that's needed to recover once the onset of symptoms are hit. That's the length of time that people are asked to isolate before going back out into more normal day-to-day living. So over the last 14 days from the date of this, we'd had 4 cases. So an average of about a little more than 1/4 a day. Throughout this period, we've averaged about half a case a day with some ups and some downs. And we've transitioned again. So
Yeah, I know.
Yeah.
I'm still working on it.
No problem. All righty. The cases per 100,000 cumulative and per 14 days is more of a state measure, since our county population's just a little over 28,000 now. That just gives the state the ability to look at all counties evenly across the board. So they look at rates based on per 100,000 citizens regardless. So a large county like Douglas next door, their per 100,000 rate would be about, they're about 380,000. So they divide by 3.8 just to, where ours is a multiplier, because we're a little over 1/4 of that 100,000 number. We'll get the slides.
I'm just going into to remove the slide transmission so we don't keep punting forward. So just keep rolling.
Yeah, no problem there. I'll just hit you the numbers as it's coming back. Hospitalizations, as of the time of the report, and we get this tracking in coordination with Tri-County Health. We do contract for some services from them. We've had 10 people hospitalized in total, and currently we have 2 hospitalized, and 7 have been released. So there was one of those asterisk deaths was a death in the hospital, so which is why the number of currently hospitalized and released doesn't equal the 10. Testing sites very early on, and I do applaud the work of Eileen and Dwayne Smith, our public health director, and working with Peak Vista in Kiowa to set up a partnership to allow testing. We were one of the first. There was a point where only about half the counties had a test site in the county, and we were were one of those, one of the few smaller counties that had their own test site. Uh, the number below is as of this morning, we've had 1,677 tests completed. And the positivity rate of those being tested currently in the county is just slightly under 4%. So 4 out of 100 that go in to get tested are coming back positive. That's down quite a bit from when we first started tracking and testing. We were pushing 7% of those tested. And if you remember early on, testing wasn't widely available throughout the state. So generally only those that had very clear and definite symptoms of COVID were getting tested, and it was essentially just a confirmation test. And at that point, the positivity rate was generally 1 in 5 or 20% were coming back. Statewide, the average right now this morning that I saw was slightly under 10% positivity rate for testing. So we're well below there. Hospital care, we've had kind of submitted our plan early on of what we were doing to Parker Adventist Centura Health, and they've kind of reviewed everything, and there's a little green bubble there that they feel they've got the capacity to handle any hospitalizations coming out of our county, which they've got a much larger service area than just ourselves, but about 70% of the folks that are hospitalized from the county wind up at Parker Adventist. So they're the primary one that we do track. Local EMS folks, we've been working with from the beginning to ensure they've got adequate PPE and that they've got the ability to respond, and that their folks, their EMTs are healthy and able to provide care. So moving on to the next column, the state status, SAH-PYN, that's safer at home / protect your neighbor. The state itself had transitioned to what they call safer at home and in the great outdoors. They're actually on the 8th iteration of that public health order. It continues to be revised. And as we know, over time, once Safer at Home came out, we started to see some businesses reopening. Most everything in the county is now open to some extent. I mean, there's still restrictions on capacities in restaurants, gyms, etc., and social distancing expectations. When Safer at Home came out, there was a mechanism that allowed individual counties to request waivers to some of the requirements, depending on local conditions. We applied over time for 3 separate waivers. The first was a little more generalized, addressing overall gathering sizes and ability to flex restrictions based on our local data, and included our overall plan for how we would track and respond to cases of COVID. The state accepted the general plan, but asked for more specifics on what measures we would like to adjust. So we had submitted 2 additional waivers after that, or variances. The first was a very specific one for gathering sizes. The result of that was essentially permission locally to go up to 100 folks and 50% capacity in buildings. These have kind of overlapped with various changes that have come out of the state. We've got the ability to pretty much expand and support our smaller restaurants that had, if 50% capacity put them under 10 people, that they could work directly with public health to design a safe dining environment, as well as related to their existing liquor licenses if they wanted to expand outside into an area that was outside the footprint that had been approved for serving of beer and liquor, that in these under the emergency terms of expanding the dining, that would still apply without having to go back through an adjustment process for that. The other items we had were related to tournament sports. When the Safer at Home and in the Great Outdoor added the in the Great Outdoors piece, there was quite a bit of opening of recreational fields, outdoor sports, but there was a restriction on traveling tournaments. We don't fall under that restriction as as a small county. We don't have a lot of tournament play that consists of all teams within our own county. We're just too small to support multiple leagues, multiple teams in each league. So that we do have a variance that allows folks from other counties that have waivers granted, which essentially means they've got lower declining rates of COVID to come in and play. And I think that was a tremendous boon to our youth too at that point. And then there were some other waivers we had that were related to provision of personal services that required a mask to be removed for that service to be provided. That waiver was granted, and then I believe within a week or so afterwards, the state had rolled that back with some other guidance across the state to allow the same. So the waiver process is kind of ongoing. The protect your neighbor piece that you may have heard about is kind of it's a further next step for each county. Once you can demonstrate that you actually have the full suite of public health capability to do contact tracing, to get people tested within 24 hours of being informed they may have been in contact with somebody, that we have the ability to isolate folks. And there's hospital capacity that would support a 20% surge. You can apply and then get a little more freedom to make local decisions. That specific guidance and the numbers associated and the metrics associated with successfully applying were just released last Friday. We've public health directors had the opportunity to start looking at that, and we will start putting together a plan to transition to protect your neighbor. It looks like at the moment the long pole in that tent is actually going to be hospital capacity, surge capacity of 20%, because the way it's written, it's not just can Parker Advantage handle the a surge that might be 3 or 4 people. It might be the 20% surge in our county, but can they support a 20% surge across their entire catchment area? So out into Douglas County and other larger population areas they support. But we will do our part to work through that. Contact tracing, our ability to reach out and touch base with people that may have been have tested positive, and then discuss with them where they may have been, and other folks that may need to be tested. We've got a person in place, a contract nurse that had been working for the county and on our public health plan that's taken up that 1 or 2 calls a day just to, and I think that piece is working well. If you kind of look over to the kind of the inset slide on the left at the top, that pretty much shows the track of COVID in the county over time since the beginning. I know it's a little bit small, but really what it illustrates is of the red line that starts at 0 and then works its way up to about right to the 60 number is the number of people that have recovered from COVID. The orange bars show the cumulative growth. And again, that rolls up to 63, the 3 that we have the number that have not recovered that unfortunately passed away. And then the green line essentially shows the trace of the total number of active cases on any given day. So we started with 3 people that were one family that was tested and positive on the 12th of March. We got that test back on the 15th. And as you move along, we kind of peaked in mid-April at about 15 active cases, and then it steadily bounced up and down, but worked its way to 0 on about the 21st of June, which meant we had about a 2-week period with no new cases, and everybody that had contracted could be assumed to be recovered. And then we've picked up a few onesies and twosies throughout, and currently sit at about 4 active cases. So, and again, this is out of 28,000 plus people in the county. The chart below shows our where those presumed active cases generally are. We don't pinpoint folks on a map for their own privacy, but just to kind of get a feel for where cases are at. As you can kind of see from the shading, the cases have been really along the western end of the county and then stretching a little bit out. Like I said, we've got the one case that's out more towards Agate that's still active. But that's kind of where that's kind of what we've experienced. Throughout, there's been a big team that's been working and in communication with the schools, with the fire districts. Our emergency manager did yeoman's work early on, getting protective equipment for our EMS crews, for our county employees, checking in on our 2 nursing facilities, Pearl Assisted Living Center and Samaritan out in Semla. We've had no outbreaks in those nursing facilities, and nor have we had one in our jail. What we've really experienced throughout this whole period, you can generally describe as essential workers, folks going up into the metro areas and potentially contracting COVID during their work day and then coming back and bringing it home to their household. Within those 67 cases that we talked about, 24 of them actually are, in 2s or 3s are multiple folks within the same household. So generally what we have been seeing is somebody will bring it back, they'll pass it to their immediate family members, and that's as far as it goes. So folks have been doing the right thing and always have in our county to keep each other safe. Nobody goes out feeling sick and hugs up on people. We haven't had a case that I'm aware of that shows any indication that somebody got COVID from somebody else at a location or an event within the county. Doesn't mean that's not true. There's nothing in any of the information that we're tracking that shows that there's been spread within the community. It's household spread, for lack of a better term. But that's kind of the soup to nuts picture of the progress of the disease throughout the county. But just wanted folks to be aware that what folks have been doing is right. Nobody wants to stay at home. Nobody likes to be restricted. But I think people are doing the right things in general. And because of that, we have, like I said, as this shows, about 4 active cases out of 28,000 people. So, the chance of coming in contact randomly within the county is pretty low, but still something to be aware of. So with that, I'll pass this over to Grant. And the next slide, he was going to talk a bit about the economic and fiscal impacts of COVID.
Yeah, can you hear me?
Yes.
Okay, good. Chris has been our leader as far as the Board of Health is concerned, and he every day meets with fellow employees and important people to keep us up to date. That I've focused more on the economic impact side of the situation, kind of based on my business experience. Budgets and cash flows and those kind of things are something that I tend to focus on. I think we have the wrong slide here. Is that so? If we go back, what I think of, Chris, was it 3 years, Rick? We set aside about $5 million, recognizing that sometime in the future there might be a major recession similar to what was in the 2008-2009 timeframe. So we wanted to make sure that the budget had some flexibility in it in terms of our funds carry forward, so that if such a situation would happen. When this virus started to rise, I started to worry that, and we all did, I shouldn't take credit for this, we all started to worry that this was going to have a major impact on our projected revenues. And as everyone knows, budgets are cash in, cash out. So if you don't have the cash in, it's going to impact your ability to serve our county citizens. So we've got the money set aside, but the first month we did this analysis, we assumed that the revenues would be impacted somewhere around 20 to 25%. As of last month, when we reviewed our income stream and our expenses and everything, I know the slide here says less than 5%. I think the actual number was 2% lower, and we were recovering very quickly from the May-June situation. So for those of you that have done budgets, well know that if you're within 2 to 5% of your projections on an annual basis, you're doing pretty darn well. So we're pretty confident about that. The direct costs for COVID stuff, and if you want me to define stuff, I'm going to defer back to Chris and Eileen, but has been about $150,000. That's for protective equipment, for different things, setting up some computer programs. All of these things are about $150,000. But we have got $2.2 million from the state that we have to attribute to COVID impacts. And Eileen and Sam, and they're helping us kind of project how that money would be best spent. It'd be a response, recovery, preparation, support citizens and businesses, stockpile equipment, and this type of thing. So one of the weaknesses of this, which I find frustrating, but it's real, is that this money has to be spent before the end of the year. So, and not only did we get the 2.2 million from the state for CARES Act, our health services people, I think, got about $400,000. So all of these things have meant that the impact to us are, at least for 2020, are de minimis. As we sit down and project out 2021, it appears like the impacts will be relatively minor because of our assessed values won't, if the values of real estate and that type of stuff go down, it really doesn't face our income stream until 2022. So we're doing some analysis on that. We don't know for sure how that's going to be, but 2020, we're going to be okay. 2021, unless something that we've not envisioned happens, we should be relatively okay. So one of the things that the reason I wanted to talk about this economic impacts a little bit, it shows that long-term planning, 2, 3, 4, 5 years and more, is very important, because there will be impacts that are unanticipated as the impacts on this virus. But I, based on at least my simple analysis, we're going to be all right for the next couple of years anyway. That's about all I have to say. Turn it back to you, Chris.
Okay, the next slide. Can you hear me, Chris?
I can hear you, Rick.
Okay. The next slide is the county transportation plan that we put out a RFP and have picked a consultant of Kimberly Horn to help us with this study. What it's doing is updating and expanding on the 2008 Western Elbert County Transportation Plan. That was a plan that was mainly from Kiowa West in the county that, studied the roads and what needed to be done and things like that. That 2008 plan showed about 100 miles of road that needed to be paved. And we've accomplished some of that since that plan. But the biggest thing that we have limiting us essentially is money. The sales tax of 1% for the county brings in close to $3 million a year. Right now, it's taking approximately $1 million per mile to pave. That's why you've seen a lot of chip sealing and stuff trying to preserve the roads and that we've had. And if you look at the budget for road and bridge, a lot of times you may see a big balance in there. That's trying to accumulate some money so that we're not doing 1 or 2 miles at a time, that we can expand the amount of paving we're doing so that we can get more bang for the buck. But this transportation plan that we're working on now is grant funded. Essentially, it's a 50-50 match between us and DOLA, which is the Department of Local Affairs. So part of that that's supporting this master plan is we've already done a 2018 pavement assessment. Essentially was going out, looking at all the pavement, trying to figure out what it would cost to maintain that pavement, or what would have to be done to keep it in good repair. Then in 2019, we did a bridge assessment, and a lot of the bridges were built, back in the 50s and 60s, and we've got some bridges that are older than that are going to need some major repairs down the road as we go. Then also we've done gravel road assessments on what the shape of those roads are, and have done traffic counts on those roads, trying to make sure that we can keep on top of the roads in the county. But part of the master or the transportation plan is that we're going to have public input sessions where the public can give their input on what they think needs to be done in the transportation plan. We'll be doing some online surveys. So when we're ready for that, we'll be getting some information out for everybody so that they can get some input. But the other biggest thing that having this transportation plan will give us some support for future funding. We've done some other roads like Kiowa Bennett and things like that, where we've gotten some grant funding in the past that we've used to help us maximize our money. So this is another plan that we're trying to work on and make sure that it is something useful that the county can look forward and do some planning on it. Road and Bridge has done some planning through the next 5 years on what they want to get in those different years, the different paving projects and things like that. So that'll help us maximize the money for this transportation plan. That's all I've got on that.
All righty. Thank you, Eileen. If we could just move forward to 7, we'll jump into questions and answers. I would ask that we've got a couple in the chat box we'll take first, and then we'll take folks from that we can unmute folks as they need. I think there's a raise hand function, or I'm not sure, Eileen, if you can describe how that works. Otherwise, we'll be able to identify folks that do want to ask questions. And
I sure can. We've got. Do you see the questions there?
I see 2 in the chat box.
Good. Okay. And I don't see anybody who's got their hand up, and I don't know that we've got a raise your hand.
Yeah.
Raise your hand functionality activated. So if anybody's got a question, you can go down to the chat icon or the Q&A icon down in the bottom. Probably the Q&A is probably the best way to do it.
Yeah.
And just to answer your question.
All righty. And then if you are on the phone and can't see you don't have a screen to go to, we can roll through what we see on screen, and then we can unmute the I think we only have 2 that have called in by phone. So if they have
So
a
this
question.
was the first one you want me to read. We'll go ahead and read the questions. The first one's an anonymous attendee who asked, hello, I'm wanting to know about the county's thoughts on the very small, but nonetheless an increase in COVID cases we're seeing. And I think we talked about those.
Okay.
So I don't know if there's anything you want to add there, Chris.
Yeah, I would just say that, you know, any case is concerning. I mean, we know that, you know, it's been pretty widely reported that asymptomatic folks can spread the disease, and you can have it without knowing you have it as well. So testing is very important, and testing is becoming more prevalent. I don't have the numbers in front of me in terms of acuity, but we've had quite a few of the cases that are coming in. There may be, I said, somebody who's employed in the city that gets sick, they come in, their whole family is tested. The spouse and child may be positive but asymptomatic. So, and there's potentials that there's asymptomatic households or others. If you look at the entire graph, there was a period of time, about 4 weeks, where we were averaging over 10 cases. Then we moved into a time frame after that that's been about a month and a half of less than 10 on any day. When we're dealing with numbers that small, it's very hard to say there's any statistical significance. Obviously, if we start seeing a rise and it continues, we have to dig in deeper. But we're generally seeing, like I said, on average, 1 new case every other day throughout. We've had as many as 3 in a day in long periods where we've had none. So I think across the state, across the nation, people are struggling with what to think about it. Obviously, I don't think we had large numbers of our folks, of people in this county that were participating in demonstrations in the cities and the densely populated areas that have seen this more. We don't probably have a lot of folks heading out to Denver nightclubs that have since been closed down. So I think just the way most of the folks in Elbert County live their Elbert County life is providing quite a bit of protection. So I don't know if Grant or Rick, if you want to add anything to that.
No, I think you've got it accurate. I think that's the biggest thing is people are being careful, and a lot of people out here, self-distance anyways, the way they live and everything. But from what I've, seen talking to people and stuff, they're conscious of their surroundings, what they're doing, and they are limiting what they're doing. They're not going to bars and things like that.
The only other thing I'd read, and you already touched on this, is that most of the new cases have been what I call rooftop situations, where somebody within that rooftop has had it, and now it's time has passed, and spouses and siblings and that type of thing are having it. So I think you told me, Chris, that this morning that of all of the cases, it was in only 22 households or something like that. It was a limited number anyway.
Yeah, I was going to say probably closer to it's in the high 40s of the 11. There were 11 households that had multiple cases. So, so I think we're probably looking in the high 40s for individual addresses across the county. And just it wasn't in the slides, and it was kind of late breaking. Obviously, the governor did issue an executive order this evening, takes effect at midnight, that essentially requires mask wear in any public building of any sort, or essentially anywhere inside that's not your private home or a hotel room. So it does affect all businesses, government facilities, any place that you don't own that you can publicly enter. Is a requirement for both folks working there and being provided services to wear a mask. Public health officers been looking through the order. Our attorney will be looking at it over the weekend. Monday we'll we'll see if there's any additional guidance or information that needs to come out from the county specifically for the county on that. We will, it can be found on the CDPHE website at this point, but essentially applies to everybody that's 11 years old or older. In terms of our restaurants, you can still go in and sit there. You don't need to be masked once you're seated. You can still sit down and eat. It does look like it will affect gymnasiums if you're working out in a group that's not a family group, that masks still need to be worn. For beauticians or others that provide their services require their client to remove the mask, that still is allowed. So the biggest change we'll likely see is those going in and out of our private local businesses that up until now has been a voluntary, left up to the business owner as to whether they would require face coverings or not for their clients. So just wanted to kind of put that out there. It's a bit of a change, and we still need to do a little digesting on exactly what it means for ourselves and our citizens.
Well, thank you, Chris. I'm sorry to interrupt. The next question that we have out here is from Daniel, and he asks, does the county have data about job loss numbers since COVID began?
I would say those are tracked. I don't have current data from the Workforce Center. When we went into COVID very healthy. We had about a 2.7% unemployment rate in the county, lower than the state average, much lower than the national average, which was hovering around 4%. In talking with Workforce a few weeks back, it looks like with furloughs, and a lot of folks were furloughed, not laid off from the jobs they were commuting to. A lot of folks were essential. It looks like our number peaked in between the 5 and 6% number, but I haven't seen what it is lately. I do believe we've had a lot of folks I know that were furloughed and now going back to work. So that number should be back down again. We did a survey of businesses within the county, and there were very few that had to lay off any employees. So it's not the most complete answer, but it's one we can dig into as well.
Thanks, Chris. Well, I'm very pleased to say that we've got 26 participants on our list, which is probably a record for us at this point. But I would say if anybody has got, there's another question. Tracy asked, are there people exempt from wearing the mask? And what if they refuse? And again, that was something that you touched on earlier that we're still kind of looking through. I know that the public health order did contain some exemptions.
Yeah,
So
and
I don't know if that's something that you want to weigh in on at this point.
Yeah, at least strictly from what the order has put out, there are exemptions, and let me find those. Thanks. Yeah. So folks that are exempt would be it's individuals 10 years and younger, and individuals who cannot medically tolerate a face covering. That goes on to say, well, there are others that are included, or individuals that are hearing impaired or otherwise disabled, where they need the ability to see the mouth is essential to communication. Individuals who are seated in a food service establishment. So as I said, once you're in and seated to dine, you certainly can remove your mask. Individuals who are exercising alone or with other members of the same household, and the face covering would interfere with the activity. Individuals that are receiving personal service where temporary removal of the face covering is necessary to perform the service. if people that enter a business and are asked to remove their mask for the purpose of identification, I assume this means bank withdrawals or others where you've got to prove you are the person you say you are. If you're actively engaged in a public safety role, such as law enforcement, firefighters, or emergency medical personnel, individuals that are officiating a religious service, and individuals who are giving a speech for broadcast or an audience. Those are the specific items that are called out. Again, the specifics of what constitutes not being able to medically tolerate a face covering, the specifics of disabilities that would preclude you from wearing a mask are not articulated at all in the order. But as I said, this came out about 3 hours ago. So we're still digesting what's in that, and CDPHE generally follows the governor's executive orders with more specific guidance.
Thanks, Chris. Yeah, I think that's going to be a developing story. One of the questions too that came up is what if you refuse, and there are issues around enforcement. And we have not had it. I personally have not had a chance to connect with the sheriff at this point, so I don't want to speak for him.
Yeah. Okay.
So Beth Shelley is on, and her question was, I heard we exceeded the 7 cases in a rolling 2-week period. Would that rescind any of our waivers? And that's the first part of her question. And the second part of her question is, can we expect county staff to be wearing masks?
Okay. I'll stay on this one. So the message should go out today to all staff from the county manager regarding the executive order on masks. We are a place of public accommodation, a public building. So yes, that could be expected. The 7 cases in a rolling 2-week period, that is one the public health director has discussed with us at length. The trigger to look at that requires some communication with CDPHE, and he's in communication with them regularly to really look at what those numbers look like. Again, if we've got 8 people in a 4-day, 2-week period, and 3 of them are all in the same household, that we're not in any way participating in something that a waiver provided. Let's say, under the waiver and the gathering, we had a public meeting with 4-H. Well, I'll take that back. Let's go to something very simple with, traveling outdoor tournaments. If you weren't participating at all in something like that, that waiver is certainly not going to be affected. But there's a mechanism that's kind of a trigger to look. And then on the public health director side, as people come and ask for how many people can attend a wedding ceremony, his comfort level of 100 may drop to 75. We'll continue to look at things on a case-by-case basis. If over the next week or so things don't continue to rise, there's really no issue. It begins a conversation and a closer look, conversation with the state and a closer look by us. So again, not the public health director, but.
But you play one on TV.
Yeah.
Thanks, Beth, for your question. I hope that helped. We have a question from one of our anonymous attendees. Thank you. Can you provide an update on where the schools stand on reopening? I know that's a developing issue, and the county is not in a position to make decisions on behalf of school districts, but I know that a number of you may have been in contact with school districts. So I don't know if there's any insight you want to give on that, or just defer to the school districts themselves.
I would defer to the school districts. I will say the three commissioners as the Board of Health and Public Health Director did receive a plan last week that was coordinated with all five superintendents that um, direct school districts that are within the county got together to put together a plan that they can all follow. I know their intent is to be as fully open with in classroom learning as normally as possible. If and I know they've at least Elizabeth Schools that my daughter is in has communicated that out to parents. So, but beyond that, our response was, it does look like, I mean, it looks like a good plan. Our public health director and his folks are there to support and make sure it's as effective and safe as possible. So that's over there.
Good. That it's I know I received the same email this morning for the school district that my kids are in, and yeah, it's an evolving situation. It's really challenging. They're doing a lot of hard work on figuring out how to make it work for everybody. So the next question is from Jim Carlson, and he asks a really good question that I believe the answer is that I believe I know the answer to, but I'm not sure. Do face shields qualify as a quote mask? And I haven't heard that specifically addressed by the governor, but I would suspect the answer is probably yes.
Yeah, I again,
But that would be a
yeah,
question for CDPHE or the
yeah,
governor's
that's
office.
that's really a Dwayne CDPHE. Though I know we have restaurants that have been very. I mean, our restaurant inspector is out regularly. I know there's restaurants that have servers that are wearing just the face shields. It's likely it does, but again,
hmm
I mean, I'm assuming based on that does meet the needs of stopping people from sneezing too much outward. But
So, and then again, another question that is probably a little bit more in depth than we're prepared to really address right now. But one of the other anonymous attendees asked, while wearing a mask, can you still concealed carry?
yeah, that is one that I think we do need to kind of defer to attorney and the sheriff and probably should put out. I know there are some states that have specific statutes that preclude you from carrying concealed while masked. I believe I've seen in many places that Colorado doesn't have such a specific requirement, but again, that's one we probably should get a specific answer out of the sheriff and attorney on. So,
That, and I'm sure many others to follow.
hello, yes.
So, yeah. So that is the last question that I see on our list. So we'll just do that awkward Zoom pause and allow anybody who's got any of our 25 attendees who've got any additional questions to enter them in. We are also live on YouTube right now, and there is a comment area
okay.
on YouTube, and I have it up on another screen, and I'm keeping an eye. I haven't seen any questions or comments on that, but we did have a few questions that I forwarded on to you, commissioners. Some of which one I just received at about 7:15 from Lori Forrington. I don't know if she's online right now, and she asks, will the county be requesting the protect your neighbor exemption? And what that is a waiver. So her question is, do we intend to move forward with protect your neighbor? And I think you talked about that a little, Chris.
Yeah, we just really last Friday, so this week got the specific measurable criteria that we have to meet, and I think almost all of them we do achieve or have come very close to, but they are related to our ability to be able to contact anybody that's positive and do any tracing within 24 hours, having the ability to have somebody tested that may have been in contact within 24 hours, and generally our ability to monitor the situation and respond. That kind of goes back to the discussion of, can our supporting hospitals support a 20% surge? Whereas under Safer at Home, they had to say they could support our surge. Now they've got to be able to state and be postured to support a 20% surge essentially in all their services for all the citizens that potentially may come in. So we will be putting together the package to apply for that, and try to knock down each measurable criteria as we go. um, like I said, that's it. The result once you move into protect your neighbor is quite a bit more, I would say, freedom to tailor what needs to happen, what measures are in place within your own county. But the state has made it a very heavy lift to get there. But that's one that we will pursue, and that we had asked at our Board of Health meeting on Wednesday for our director to start putting that, pen to paper, so we have that plan sketched out, and then we continue to fill it in. There's been really a lot of work done by that small team. As you know, we don't have a lot of hotels in Elbert County, but periodically you may get somebody that is, tests positive. They need to self-isolate. Perhaps they live at home with an older parent or somebody who's vulnerable, and there's just no way that within their living condition they can isolate themselves from somebody else at risk. Our emergency manager actually has worked with the emergency management office in Douglas County, and identified some hotels that they have contracted with specifically for this case. We've been working with local food banks. We've done some delivery of food to folks. There's a lot of little aspects of this that we work in partnership with others. I think I had mentioned earlier, Tri-County Health has a very robust group of folks that have access and the ability to dive a lot deeper into the data that flows from everywhere in the state on every day. And so on our behalf, they're tracking our hospitalizations. They've got a little dashboard up under Tri-County Health that has some information regarding our county as well. So pretty much our data analysis piece, as I said, such as it is, because our numbers are so small, we're able to use their services. That doesn't mean we're not part of Tri-County Health. Their orders don't affect Elbert County, but they are a capability, and we have traditionally used them for years to help assist in managing some of the larger grants we have for tobacco cessation, opioid abuse. There's a lot of things that we essentially contract for service with Tri-County for. So when we feel we've met when we can actually meet the measurable requirements, it's not really do we feel it. There's actually some good criteria that have to be met, and we know what those criteria are. We will submit. Nobody in the state has at this point, so I think everybody's also eagerly awaiting to see what the results of the first one that goes in. If we, it's the way we worked through the waiver process quite a bit too, is what were others doing? What did success look like? What questions were asked of them before they were granted, so we could refine the information we sent forward.
One thing I was going to say is, I think in that order today, it also said that they were not going to do any kind of waivers or anything for 2 weeks. So who knows how long they may extend that down the road, or if it's the end of the 2 weeks, how many people have put something in, how long it's going to take them to approve something.
Yeah, that's a good point.
All right, well, that was a good discussion of a very uncertain issue that we're facing. And I've got a surprise. We have got a question about a matter that is entirely unrelated to COVID.
Oh,
And that question is from Dan Click. He emailed me earlier today, and I believe that he is one of our attendees. And I have an allow to talk button here, so I'm giving Dan a little bit of a heads up that I'm going to click on his allow to talk button and see if he can weigh in. He has a question about road conditions on County Road 27 relating to the gun clubs that are over in that direction. So I'm going to click here, and Dan, if you want to ask your question. You're muted, so I can unmute you if you'd like me to. Or you can just press the space bar on your computer, or you can click on unmute. I'm going to go ahead and unmute. Maybe, maybe not. Well, then we will just, I don't know if he's there. So I'm going to ask his question on his behalf. What are the plans for the horrible road conditions on County Road 27 due to increased volume of traffic due to the 2 gun clubs in the middle of a community? Noise pollution at all hours. So I don't know if any of you are familiar with that area and with that situation and might want to weigh in, or do we need to get back to Dan with that information?
well, first, I just want to say that, Mr. Click, I know you were present at the hearing we opened for the Quail Run, and that is an ongoing hearing. We've continued it, so anything specifically regarding that application, we really can't speak to, but road conditions in general, certainly we can. I've been doing a lot of talking, if Grant or Rick, Grant, I know, for the last 3 years, we've been working quite a bit with roads. If you want to weigh in on what Road and Bridge has been doing and how we've been tackling the deteriorating gravel roads.
Yeah, the traffic does affect gravel roads, and what really affects our roads this year has been the drought. But the increased traffic, as Chris just said, that application is still before us, and that'll be certainly one of the things that's discussed. And I understand that you mentioned that there was 2 gun clubs there, and the second gun club also has an application before us. So this is something that's going to be reviewed, and I can't tell you what the outcome will be because I haven't seen all the data yet, but we want the roads in the entire county to get better. And we haven't been totally successful, but we're working on it. This one is particularly interesting because of the 2 gun clubs. And I assure you, we're going to be discussing that at a public hearing.
Thank you, Grant.
That's all I got to say.
Yeah, I'm pulling up another question, some questions, and of course now we're getting back to, we had a brief respite from the COVID questions, and now we're back to them.
That's fine.
And this is one that I forwarded you earlier from Donna, I believe. Is it possible for Elbert County to opt out of the governor's mask mandate? I don't believe that was something that we talked about.
Okay. Yeah, I would, like I said, kind of newly developing. This was issued as an executive order. The order that initiated Safer at Home actually included specific language that allowed us to apply for the variances we have. This does not. So at least as it is written now, if it's not amended for the next 30 days, unless it's extended or revoked, this is the statewide order. So I mean that's the black and white version of it. It's interesting in the frequently asked questions paper that was published by CDPHE in the concurrently with the publication of the order. There was a question in there: is why did the state wait until now to issue the mandatory order? There's a statement in there that 39 counties and municipalities had issued such an order, and a statewide order helps eliminate confusion and makes mask requirements more consistent across the state. Personally, I will say that's a weak statement when you've, and this is me, Commissioner Chris Richardson, not a county position, but the state under Safer at Home had a very robust and very well utilized variance process that allowed different areas of the county to tailor or at least request a relief from things that didn't make sense in their area. That is part of the reason why there is inconsistency across the state, is because the effects of COVID across the state have been inconsistent. There's still 3 counties in the state that haven't had one single case of COVID. And certainly there's areas of the county areas of the state where there's a tremendous amount of COVID. So to say that one of the reasons that this is being issued is because people are doing things differently in different parts of the state kind of flies in the face of establishing a structure that allows counties to ask for variances. So as I said, all brand new to us. There's a lot of questions I have that I want to get directed back to the state as soon as we can. Hopefully there'll be some thought process to allow rational decision making in localities to address local problems. But that's kind of my personal statement on that. I don't know if Grant or Rick have any thoughts on that.
Doesn't look.
I think
I-
similarly.
Yeah, I would say, since it just came out, we're gonna have to talk with the attorney and things like that and really delve into what the legal rights that the county has versus the state and things like that. And at this point, we haven't really gone that far.
Great. So the next question that I have from my email to our public information officer email was something that I forwarded yesterday. It's kind of a lengthy question from David Harris, who I do also see on our attendees list. And it has to do with a rezoning. He thinks it's a rezoning question is an important topic to the citizens of Elbert County. And he asked a little bit about going over the 6 general questions that are the basis for rezoning judgments by the board. I know, Chris, you talked a little bit about one of our recent land use hearings about some of these matters and the whole rezoning process. So I'm going to give a try again to allow David to talk, to see if maybe he can restate his question and let us know what the information he's looking for. So David, I'm going to click on allow you to talk and see if we can get you on the line here. So there he is.
Can you hear me?
Yes, we can. Welcome.
Thank you. Yeah, having just gone through the Sweetbriar rezoning hearings, at least for myself, it was a big surprise that Article 3C, Paragraph 4 was the only criteria that seems to be used in rezoning. And so I was thinking maybe the commissioners could have a mini training session to inform the general public how they are making decisions for rezoning. It doesn't seem like all of the county zoning regulations are being used. For example, the use table and the other 201 pages beyond Article 3C, Paragraph 4. So I just was hoping you could give I asked the county attorney to give his opinion on the shall consist of phrase in Article 3C, Paragraph 4, and his response was that the county procedures, he would be breaching confidentiality if he answered any questions on the county procedures. So could you just overview for the general public how the rezoning laws are used in rezoning hearings and how the general public's input is used in the decision process?
Okay, I'll I'll start on that, and I certainly ask the other two commissioners to weigh in. As I kind of opened the hearings yesterday, there's different, there's three different manners in which the Board of County Commissioners can act, or I think most people grow up through, in their youth, you learn about the separations of powers in government, executive, judicial, legislative, at the national level, state level, those powers are vested in, a governor or the president as the executive. There's a legislature that legislates and develops law, and then there's a judicial branch that applies the laws that are as they're written to matters that come before them. You get to the county level, and those three areas kind of collapse into a single body. The Board of County Commissioners, made up of three people, and the kind of the separation piece or the checks and balances comes with having those three different people looking and being part of each of those decisions. So a lot of what we do day to day is executive type functions. We're managing a budget. We're providing guidance to staff in fulfilling their duties and carrying out the functions of the county. In terms of land use, when there are changes proposed to land use regulation, we're acting as a legislative body. We can take broad input, look at what the impacts of our current regulations are, and consider proposed changes. Changes to the regulations, it can be driven by commissioners, by planning commission recommendations, by staff recommendations. That process, once a recommendation is made, and I should have actually mentioned importantly the planning commission and the commissioners, we serve the public. So when I'm saying the planning commission proposes or the commissioners do, it's not just what comes out of our heads, but in conversations, in communications with concerns of the public or issues that were not anticipated. When you write a regulation, there's often you don't know until you've applied it if it's going to have some second or third order effects that weren't anticipated and coming back to review them. So we've about early in 2018, 17 and 18, there was quite a bit of work done, regulatory work done, and Grant certainly can jump in at any point here. The land use regulations that we had in place consisted of primarily Xerox typed ancient code that had then been patched and patched and patched with resolutions over probably a couple of decades, to the point where you really had to read everything, every document, to make sure you were covering all the bases if an application was going forward. So there was an awful lot of effort to consolidate everything that was current into one document, to pull together and deconflict resolutions that overrode one another, to come up with a coherent process from the beginning to end for either zoning matters or subdivision. Those were, I believe it was in late 18 that we adopted the base version, and knew at that time that it was likely an 80 to 90% product that as applications came through, we'd recognize that there were fixes that need to be made, and we put something in place for initially quarterly, and now about semi-annually, we've addressed changes to those regulations as the need has arisen. We're in the midst of one of those changes now. So again, there's kind of an ongoing hearing with that. But when it comes to an actual rezone, I mean, I think, Mr. Harris, you may have a little overstated. I mean, the entirety of the zoning regulation does come into play. Yeah, you made a comment about you only look at these 6 factors, but not the tables. The tables of uses are what are allowed under a specific type of zoning. So if somebody has a property that's zoned agricultural, there is a lengthy list of what can be done by right or with a special use permit under the current zoning. If somebody comes in and requests a rezone to something else, whether it's industrial or something else within the agricultural context, residential ag, or ag residential, there are fewer uses associated with that if that decision is made, and those zoning tables are then looked at when somebody comes in to say, hey, I want to do X on my property. I want to put in a small electrical substation. The piece of property was AR purchased by IREA and they want to put a substation in. That is not a use by right on an AR zone property. It is a use that's contemplated in ag zoning. So that's where the table comes in. Once the zoning is applied, I mean, when somebody wants to change zoning, it defines what could be done if that zoning changes, but under its current zoning, it also defines what can be done with that property as a use by right or as a special use. If it's a use by right, then essentially there's no decisions or public decisions that need to be made. People can exercise that right. If it's a use by special review, then there'll be a hearing process to determine whether that use is appropriate or how that use can be made appropriate by applying specific conditions. Like I said, I wasn't party to the conversation you had with the attorney. Generally, if asked to provide legal advice by a member of the public, his answer is going to be that he is the legal advisor to the county, and there's always a potential that there could be legal conflict between the county as an entity and a citizen, and he does not. He cannot put himself in conflict by giving legal advice to a citizen. So that's probably what that discussion consisted of. But my read of it is there are 6 items that must be looked at when the staff is determining whether a rezone is appropriate. If again, I'm not an attorney, my read is that those 6 items have to be looked at. It doesn't state those are the only items that can be looked at, but if a decision is made based on something that's not on that list, it's likely something that would be challengeable in a court of law. So if something were denied because 7th, 8th, or 9th criteria was applied, there's a very heavy lift in a court of law, likely if that denial was challenged, to be able to say the county had the authority, or we as the Board of County Commissioners had the authority to deny an application based on a criteria that was not stated. But it's in my mind, a fairly flexible framework, and the one we discuss most often with applicants and the public is the compatibility or harmony of something that is proposed with the rest of the area. And I think the staff and technical reviews has to take a very strict look at what's compatible. And it's generally very, like I said, very technical compatibility. Does the traffic that may be added, is it supported by the road network? If not, can it be made compatible by putting a condition on that somebody must improve, a developer needs to improve the roads or add additional roads? The environmental there's environmental factors, there's others that can be looked at a little bit more critically, and the Planning Commission generally takes that that tack as well in considering an application again for specifically for rezone against those criteria. During those public hearings, the Planning Commission also is the opportunity for the public to raise those issues of compatibility and harmony. So those are recorded, those are available for those to be considered when a final decision is made after the Planning Commission's recommendation. So, I think the thing you generally find in land use, and that's probably one of the most controversial areas that we deal in, because generally folks don't like change. If you've adopted, if you came here because you loved what you saw and then things change, definitely it is something that is of concern. So, and we do take those concerns seriously. But you also find that, that's when we're balancing and looking at what people consider to be competing property rights, you have to be very clear on specifically what is a property right. I mean, clearly your property right extends to the boundaries of your property, but when people start claiming rights that move beyond their properties because a neighbor is doing something that disturbs them, and I'm not saying they're not right to be disturbed, it becomes something that needs to be looked at much more carefully. Is this a measurable impact? Is it a subjective impact? Is it something that is entirely unforeseeable and that a neighbor may not have had any reason to ever believe that something very different would be happening right next door to them? Those are things that we do take into consideration, or I do, as we look at an application. So, and again, I know I've been talking now for a long time, so I will stop and let's see, Grant or Rick, if you want to weigh in on that.
Yeah, the only comment I have, what you said is right, but those 6 or 7 items, if they're met, as a quasi judicial situation, we have to evaluate them as they're presented. We get quite a few applications too that don't meet those criterion. And then we elevate the application into a special use kind of a situation. And there is a lot more information that's required in terms of end uses and those kind of things. 217 pages, that covers a lot of different subjects in terms of what different citizens, property owners apply for from time to time. And we've best attempted to cover all of those items to the way we can. Now, Chris's comment about updating our regulations, and we'll continue to update them. So if you've got something that you want us to consider, bring it to one of our meetings and we'll consider it. I got to say, I've lived in the county about 30 years, and 14 of those years I was on the Planning Commission. And what Chris said early on, those rules were basically glued together over time, multiple different commissioners, multiple different viewpoints on things. And we hired an outside consultant to help us consolidate those things. One of the things we found, though, is that sometimes outside consultants are not necessarily tuned in to county citizens' viewpoints. So I'm going to defer to Chris here, but I think we've updated those regulations. This will be the 3rd or 4th time. And what happens is that we'll have an application that doesn't really fit our understanding of what we're trying to do. And so we'll try and correct that. And we've got one coming up here next week where we're trying to correct some inconsistencies within those regulations. And if we have other inconsistencies, we're sure willing to listen to them. I think, Mr. Harris, you've sent us probably a half a dozen, and I don't know if it's 5 or 7, but several emails. And I guarantee that each and every one of us as commissioners has read them.
And if I could
Yeah,
add, just quickly, that when it comes to changing regulation, it's a slow process, and probably rightfully so, because when a change is proposed wholesale, and certainly in a zoning regulation, there's a potential for certainly for unintended consequences. But I know I have read through what you had submitted, some of the proposals. Those really need to be looked at very, deeply by staff and planning commission before coming to us, because some of them would require, in order to adopt them, I'm not saying I'm not giving an opinion on validity or importance, but in order to do some of the things that I've seen proposed, it would require additional staff. So a good idea that we don't have the resources to implement is something that it has to stay on the table as a good idea and something to continue to be considered, but it also has to be looked at in terms of, do we have the resources to implement? We are trying to improve continuously. And in the world of regulation, continuous change also can lead to a lot of just inconsistencies and confusion. If the rules of the game continue to change, it makes it very hard for everybody to know what's going on. When it comes time to actually consider the application, we've got to consider it in terms of the rules that were in place, or the regulations that were in place when the application itself was fully submitted. So this will be a continuous process, but the one thing that the outcome of the process is not going to be this regulation plus this patch, plus this patch, plus this patch. They will be, changes are integrated fully as they come in. And so we don't get to the point we were before, where there was just a soup of regulation that was internally conflicting. So.
Thank you for your comments. I look forward to dealing with you all with the proposed amendments. If you would like me to prioritize those, or you think any of those are burdensome to the county, I'd be interested in hearing which is one those that you're referring to. My main concern is Article 3C, Paragraph 4. That is not, Commissioner Richardson, as you referred to, you said that is not the sole criteria, but certainly in the Wheat-Briar hearings, that was the only thing that was presented. And so it does certainly give the impression that that is the only part of the regulation that is used in rezoning. But yeah, I would be happy to work with anyone that is willing to listen. I think listening to the public is important. I already submitted the comparison regulation from Douglas County, which when you read it, I think you will realize is significantly different from what Elbert County currently has. So I've suggested either some minor changes to Article 3C, Paragraph 4, or a total replacement using Douglas County's leadership for the process that they've described in their regulations. As you said, you commissioners from Elbert County do reach out to other groups to get good ideas and look at what they're doing. So I'm appealing to you that you give some consideration to how Douglas County is wording how their citizen input is considered during the rezoning process. I think it must be clear to you that the rezoning is a pretty hot issue for the citizens right now. And I think that deserves some of your attention. So thank you for your time and your comments. I appreciate the time you spent on the question. I appreciate your feedback. And other than that, I've had my say for tonight. I'll let others go ahead with other questions.
Thank you, sir.
Thank you. Thank you, David. I'm going to disable yours. We do have a follow-on question from Patty Justice relating to zoning, but I just do want to note that it's 8 o'clock. I want to be respectful of everybody's time. So I'll leave it up to you, commissioners, whether or not you'd like to take one last question.
Yeah, like I said, I see the question, and Ms. Justice, I know specifically what property you're talking to in regard to, and the compliance issues that are ongoing there. So,
Okay,
yeah,
got it.
Yeah.
Well, we can communicate on that then in another format. And so I would like to just thank you guys for taking the time. So it's really informative, I believe. If you've got any final comments, and then we'll wrap up.
My only comment is thanks for all of the citizens for participating. It means a lot for us to interface with you all, and I hope that what's been said tonight is useful. Thanks again.
The only thing I would say is, when we do have the hearings, we do listen to the citizens' comments, and a lot of times it may seem like we don't take those into consideration, but we really do. And sometimes, the regulations, the way they are, and the way we lead on whether we have to follow the regulations or not dictates our decisions. And I don't know, I just think that we really do listen, and sometimes our decisions, doesn't make everybody happy, but we're trying to do the best job we can.
I'll just finish up by saying these are very valuable to us. I hope the folks that dialed in tonight found value in it, but this isn't the only way to communicate with us. And like I said, you don't have to come to a Board of County Commissioners meeting to raise an issue. Give us a phone call, give us, send an email, send a note through the PIO, stop by the county if your time allows, Monday through Thursday. If you'd like to come out and talk with an HOA or talk with a neighbor group or just meet for a cup of coffee, any one of us are always open to that. It's one of the nice things about being Elbert County and not a growing Douglas or Arapahoe or El Paso. We have the time to spend talking with citizens and hearing issues and helping individually as commissioners kind of guide you through processes. That isn't something that larger counties generally have. Commissioners in larger counties, when I talk to them, there's quite a bit of study and thick books of stuff prepared by staff, and they come in to make a decision. We're much more participative in that, and probably more so than Eileen and Sam may sometimes wish we were, but
Sorry, I was
I'll
unmuted.
no, that's quite all right. But I'll leave it there. I mean, if there are any questions, we're all three of us are always available, and whether it's the one of the three of us you're more comfortable dealing with, or the commissioner that lives within your district, we're all on the lookout for the entire county. So just send us your cards and letters, and we'll get back to you and keep working through things, because that's what we're here for. So thank you.
Great. Thank you so much. I appreciate it. This has been a really good session. We'll go ahead and close it out now, and just know that it's available on YouTube for viewing at another time if you'd like. So thank you very much, everybody, and good night.
Right.